what we're doing today in this case is we're doing an uncovering. And when a patient has their implants placed, we typically leave them in the bone and covered by the gums for 3 to 4 months, and in some cases longer. So, I have Dr. Leon here. What do you look for to see if an implant is ready to be uncovered?
I take an X-ray and see if we see nice osseointegration, and usually it takes about 4 months, especially if I also look at when it was placed, if we had primary stability and how it torqued.
Great. Yeah, so those are some really important things to know to see how long you should wait for the implant to be integrated, and then we can look at the X-ray, like he said, to see if the bones have integrated in between the threads of the implant. So now we know that the implant's integrated, and now it's time for the procedure called uncovering, or sometimes they called it a second surgery. So do you mind walking us through what that's like?
Sure. It's very minor. We put a little anesthetic in the area. We infiltrate the area with anesthetic, and then we punch a little hole around the implant, and we put what's called a healing abutment. So the tissue can heal for about 2 weeks around the actual healing abutment, and then we'll put the real abutment, which will hold the crown. 2 weeks after that, we can take an impression, and shortly after, have the real crown.
So in this case, we did 5 uncoverings on this patient. She had implants done all over her mouth, and they were all really well integrated. And one of the implants actually was so well healed that the bone grew over the top of the implant. So it's kind of a hassle for us when that happens, but it's a really good indicator of healthy implants. And so we don't mind taking the extra step to go ahead and remove that little top layer of bone when we have to. In some cases, we'll use a tissue punch, like Dr. Leon explained, and in other cases, we'll just make a small incision. Some sites will need a suture or two, and some sites will just be held open with the healing abutment and don't need stitches at all. So do you typically prescribe antibiotics or anything for that procedure?
No, I typically do not.
Right. So just a little saltwater rinse, and then see you in 2 weeks for the digital scan.